The first step in this procedure is proper hand hygiene. Washing your hands is one of the most effective ways to prevent infection in the hospital setting. Upon entering the NICU, or Neonatal Intensive Care Unit, it is important to wash your hands thoroughly and effectively. Before performing any procedure, it is important to verify the patient's identity and the presence of a physician's order. In this image, you see our patient Sophie. Verify Sophie's identity using two forms of ID. This can be the ID around her ankle and the ID on her isolette. When approaching the patient's bed in the NICU, you may encounter the parents of the child at bedside. If this occurs, explain to the parents the procedure, the order, and the indications behind it. Assess the parent's level of understanding before performing the procedure. After you have verified the patient's identity, you need to gather your materials for this procedure. For the umbilical artery catheter draw, you will need gauze, an alcohol pad, a syringe for waste, a syringe for your sample, a syringe full of flush. If you do not have a flush solution prepared, you will need to draw up from a 0.9% sodium chloride solution, about 3 cc's. You will also need gloves, a bag to carry your sample in, and a patient label. Once you have your supplies combined in one place near the isolette, wash your hands or use hand sanitizer and put on a pair of gloves. Now, you may gather your supplies and place it in the isolette close enough so you can easily grab it while maneuvering the UAC. Place gauze underneath the port for the UAC and prep your syringe to draw your waste solution. Begin by unscrewing the cap off of the port. Make sure that when you place the cap down, the sterile end does not come in contact with any other surface. Screw the syringe onto the port. Once the syringe is screwed on securely, open the stopcock so that blood may flow freely into the syringe. Pull back enough to clear the dead space of the tube to prevent any chemicals or contaminants from being in our sample. That can roughly be about 1.5 cc's. Turn the stopcock to a 45-degree angle to shut it off to all sides. Unscrew your waste and set it aside. Grab the syringe for your sample, screw it on, and open the stopcock to the syringe. Pull back roughly 0.3 to 0.5 cc's of blood. Once you have enough blood to run your sample, turn the stopcock again to 45-degree angle to shut it off on all sides. Unscrew your sample syringe, press out any air, cap it, and place a patient label on it. Screw the flush syringe to the port and turn the stopcock so it's open from the syringe through the tube. Push enough saline so that the liquid in the tube is clear. Keep track of the amount of fluid you are giving. As the liquid in the tube runs clear, turn the stopcock off to the port and unscrew the syringe of saline. There should be just enough saline left in the port to bubble over the top as you screw the cap back on. Use the gauze in the isolette to wipe up any excess fluid around the UAC and pick up all the supplies you brought into the isolette with you. With your sample labeled, close the isolette and dispose of your garbage. Place the sample in a bag or as designated by your facility to send it to the lab for gas analysis. Dispose of any materials containing blood or sharps into the designated biohazard sharps container. We will now observe the whole procedure from top to bottom. If you need to review any of the steps, please see previous footage.